should not be there in the first place. So yes, absolutely excused.
Second, Mr. Niemeyer. Any other discussion?
That's worth a no.
Hearing none, all those in favor of excusing Mr. Russell say aye.
Aye.
Any opposed, nay. He is excused. I ask everybody to stand for the Pledge of Allegiance and a moment of silence honoring Toledo Police Officer Brandon Stalker. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We have no add-ons or replacements this evening. Oh, I'm sorry, I need to have the previous council meeting minutes approved. Mr. Slough.
I move the minutes be approved as circulated.
Second, Mr. Palmer. Any discussion? Hearing none, all those in favor of accepting the previous city council meeting minutes say aye.
Aye.
Any opposed, nay. They are approved. We do not have any add-ons or removals from tonight's agenda. We have no proclamations, recognitions, resolutions, retirement resolutions, I'm sorry, oral communications, petitions, written communication. We will now move on to reports of municipal officers and departments.
City Income Tax Monthly Collections Report for December 2020.
Questions or comments? Report to be filed.
Findlay Fire Departmental Activities Report, it's actually for December 2020.
Questions or comments? Report to be filed.
Findlay Municipal Court Activities Report, that is also supposed to be for December 2020.
Questions or comments? Report to be filed.
Findlay Police Departmental Activities Report, that should be December 2020.
Questions or comments? Report to be filed.
City Planning Commission agenda for January 14th, 2021, as well as the minutes of December 10th, 2020, and also the minutes of January 14th, 2021.
Questions or comments? Hearing none, agenda and minutes will be filed.
Precipitation and reservoir levels report for fourth quarter of October through December 2020.
Questions or comments? Report to be filed.
A letter from Mayor Mern regarding tax administrator appointment. This does require council's confirmation.
I would enter Mr. Slack.
I would move to confirm the mayor's appointment of Mr. Duran. Is that his name?
Second, Mr. Greeno. Any questions or comments? Hearing none, all those in favor of the appointment, say aye.
Aye.
Those opposed, nay. At this time, I'd like the mayor to come up and introduce him.
Wonderful. Corey, go ahead and come up. Just wanted to take this opportunity to introduce Corey Duran. He is the new income tax administrator taking over for Andrew Thomas, who retired last year after nearly 30 years of service to the city. So Corey certainly has big shoes to fill, but he's been working the last couple of months to train under Andrew. You want to say anything real quick?
Yeah, sure. Just wanted to say I'm happy to be here. I found a very great environment with the people that I've found so far, and I really appreciate the attitude and just the positivity. So as Mayor said, I have some big shoes to fill with Andrew, but I'm hitting the ground running and happy to be here. Thank you.
Welcome, Corey. Welcome. I've already named a street after you.
A letter from Mayor Mern regarding various boards and commission appointments that do not require the council's confirmation.
First is the Airport Advisory Board. That's Roy Alexander, Matt Rudder, whose terms will expire December 31st. Second is the Parks and Recreation Board, Colin Earl, whose term will expire on December 31st, 2023, as did the Airport Advisory Board. Shade Tree Commission, Ben Dolan, Ed Crawford, and Tom Mills. Their terms will expire December 31st, 2023, and I'm sure they will all do a stellar job.
Letter from Police Chief Ring regarding Cuyahoga County, Ohio Internet Crimes Against Children Task Force grant.
Questions or comments? Letter to be filed.
Letter from Mayor Murn regarding various boards and commission appointments that do require council's confirmation. The first one being Downtown Design Review Board for Josette Brinkman and Brad Wagner, whose terms will expire December 31st of 2023, and Jamie Robertson, who is filling the unexpired term of Sharon Rooney, whose term will expire December 31st, 2021. One at a time. You want me to do one at a time?
I don't know if we have to.
We have to confirm them all.
Okay, Mr. Webster.
Make a motion to confirm the folks for Downtown Design Review Board.
Second, Mr. Hellman. Discussion. And that motion is to approve all three. Any other questions or comments? Hearing none. All those in favor say aye.
Aye.
Any opposed, nay. They are confirmed.
The next one is the Hancock Regional Planning Commission for Don Bledsoe, Jody O'Brien, Christy Ranzow, Matthew Letty, and Dwayne Bowes. All's term will expire December 31st, 2022.
Mr. Hellman.
Yes, I move to accept the recommendations for the Hancock Regional Planning Commission as presented.
Second, Mr. Schindeldecker. Any questions or comments? Hearing none, all those in favor of the confirmations of the people discussed, say aye.
Aye.
Those opposed, nay. The 5 of them are confirmed.
In the Street Designation Committee, term to expire December 31st of 2022 for Dale Gillespie.
Mr. Hellman.
Yes, I move to accept the recommendations for Street Designation Committee as presented.
Second, Mr. Greeno. Any discussion? Mr. Gillespie was a former city councilman. That's my only discussion. All those in favor, say aye.
Aye.
Those opposed, nay. He is confirmed.
Letter from Mayor Murn regarding the mobile health clinic.
I request the letter be read out loud to council.
Second, Mr. Wobser. All those in favor that the letter be read, say aye. Any opposed, nay. The letter will be read. Thank you.
Over the last few years, Hancock Public Health has been working with the Findlay Rotary Club to investigate and begin fundraising for a mobile health clinic to serve the Findlay Hancock County community. I was recently approached by Hancock Public Health and a number of other community leaders requesting the City of Findlay assist in the initial funding of the mobile unit to be able to jumpstart this project. This unit, which was previously needed for such things as blood pressure screenings, mental health services, immunizations, social services, harm reduction, and many other public health services, can be the literal vehicle to vaccine distribution. After a number of conversations from the entity representatives from Blanchard Valley Health System, Findlay Rotary Club, Hancock Public Health, the Findlay Hancock County Community Foundation, Hancock County Commissioners, and the Adamus Board, I now feel comfortable recommending to Findlay City Council a one-time appropriation of $150,000 to support such a program in Hancock County. The estimated expense to get this unit purchased, equipped, and operational for the next 2 years is nearly $700,000. This includes all personnel, materials, insurance, etc. Currently, $175,000 is committed, and following our donation, the remaining amounts are expected to be received from other local donors and grant awards, a number of which are already verbally committed. Following this initial investment, Hancock Public Health expects to fully cover the annual operations through Medicaid collections, grants, and other state and federal funds. With this financial commitment from Council, Hancock Public Health will be able to purchase the mobile unit with the goal of it being operational by late March. In addition to the community health benefits provided, there is also potential financial benefits to local employers who can work with Hancock Public Health for on-site screenings, which can provide a cost benefit in insurance plans. Included with this letter is a brief summary about the mobile health clinic. I look forward to our discussion on this topic and swift action to support this cause.
Mr. Slout.
Just a quick question, is the county going to participate in this program? And if so, what would their fee be, their dollar amount?
Mayor Muir.
Now, I can't make any formal commitment, and we won't call them to the podium unless they really want to, but they have been a part of the discussion. I believe they're open to supporting this project, and wanted to see what direction the city was going before making a formal action.
Thank you.
Sound good?
Any other questions? Mr. Hellman?
Yeah, I guess I'd just like to make a statement where I would 100% support this initiative. I know I've been a Rotarian for many years, also serve on the board currently, and they have gone through quite a few different iterations of how to get this accomplished. It has been spearheaded by Bill Roos, the former president and CEO of the hospital, and he is 100% behind this and has put an awful lot of time and effort, as have many other people. So I guess I would just encourage our support and would encourage the mayor and the city to proceed. Thank you.
Mr. Wilson?
Mayor, did you want to go first? I'm sorry.
I was just going to state, this thing clearly needs to be fixed. Want to kind of give a background on why Rotary kind of was the organization helping do this. As Mr. Hellman mentioned, Dr. Bill Roos was really kind of a driving force in seeing this as needed in the community. And as was stated in the letter, it really came out of the need for getting access and kind of reaching out into the community to then plug those folks that may not typically look for help into the healthcare system. So this would be working in conjunction with our other healthcare providers in the community, whether it's directing them to the Kaufman Clinic at the Family Resource Center, getting them connected with a primary care physician, or otherwise. They will be able to also assist with getting folks set up on insurance if they don't have it, just walking through and kind of being that guiding presence, which the health department is known for. Rotary really got involved because they were planning over a number of years to fundraise for this. There's one similar through Ohio Northern University down in Ada that they've been operating since 2015, primarily through Ohio Northern University, reaching out into the community, doing blood pressure screenings, cholesterol screenings, etc. And so they started fundraising and have supported the project over the last number of years through various fundraisers. They were hoping to kind of get those initial expenses put together to then donate the unit to the health department. Obviously, the COVID crisis has kind of jump-started that and said we really would benefit from it sooner rather than later. So how can we make that happen? So we've been working with a number of entities to kind of say, what should this look like? What are the operations? What's the staffing? What, all of those logistics. So those conversations have definitely been occurring and will continue to occur. What we have in front of you is saying, how can we support this so that they can get a vehicle purchased, get it up and operational, because there is a lead time on retrofitting a unit like this. So just wanted to provide a little more background, and I have a lot more we can talk about depending on your level of question.
Mayor, who's going to own the unit once it's paid for?
It would be the health department.
Okay. And then, so once it's purchased and up and running, they're going to take care of the ongoing expenses year to year?
Correct. And one of the things I want to point out, since we obviously help fund the health department, it was the conversation of stating, I don't want to help get this up and running and then my bill to suddenly increase significantly. And so that was heard loud and clear. That's why they have stated that there is a variety of funding out to support this. The other thing I want to mention is scalable. So the projections of it costing about $235,000 annually to operate is based off of operating 35 hours a week. So there, obviously, if we're out doing vaccinations, we're doing a bunch of blood, sometimes we're going to be doing that. But not all weeks. And if we're not, then we're not going to have the expense because they're going to be working in other areas or they're going to be contracted. I know the University of Findlay Pharmacy Department has been engaged in how can this provide an outlet for some of their students. So this is definitely a complex topic, but it's something that I think has been very well vetted, thought of, and will continue to kind of work through. And while we're on it, if I may, just kind of get a couple of key points. I was going to bring the Hancock County Health Assessment document, but it's almost 200 pages. And so I decided that I would just tell you that it's out there if you'd like to read it. But there are a number of underserved individuals within our community, whether it be individuals who 72% of folks are not getting routine checkups. 89% of residents don't have or do have a personal doctor, but that's 11% of folks that are still not getting that preventative action, which is so important. 5% are uninsured. Even in this day and age, obviously we have a large population that have high blood pressure, obesity, high cholesterol, and a lot of these actions are things that when we can kind of intervene and work with them to kind of take that initial step and make them comfortable with getting into the healthcare system, you can really help prevent larger expenses for those individuals and catastrophic health events. So some of the programming that would be provided, again, what was mentioned there, but tobacco cessation planning, mental health interventions, family counseling. This can go out to the schools and do, nutritional advisement and activities, again, helping folks just kind of get used to working and interacting with the health department. So it has a lot of opportunity, and I think especially after that initial, this upfront investment has the ability to really be sustainable, which has been my big question long term. I don't want to buy it just to be able to do something related to right now and make a reaction, but how do we make sure that it's something that's long term sustainable? And it really came out of discussions over a number of years. So I feel comfortable with it.
Mr. Wilson.
Mayor, what do we think? You mentioned the one in Ada, I believe, similar type of situation.
Correct.
So what's their percentage use of that?
I didn't get the specific numbers, but I know that when they were putting together our program, they were talking closely with them.
Okay, so they found that they kept the thing busy enough to make it worthwhile, I guess is my point.
Yes, they've had it since 2015, and I know they take it to health fairs, they take it to community festivals, they take it to schools, they do take it to food banks, city mission, so they're using it very regularly.
Okay. And I know that we've got two of the county commissioners here tonight, and that you guys have not gotten involved in that. They have not become involved in this yet.
They have not made a financial commitment, but I know Commissioner Keppel has been on a couple of the calls regarding this topic.
Okay, so I would be probably more lenient to get involved, leaning towards getting involved in this if I knew the county was, and I hate to do anything contingent on the county doing something. Gotten my ass burned in that in recent years, so I'm not going to do that but I think that would be something from our perspective. We would like to know what their commitment level would be also.
So, yes, and I think it's like a chicken and egg situation, like everybody's kind of like, well, then you do it. So I think if we can say this is something we're interested in moving forward with, we can get legislation. Obviously kind of wanted to get feedback on the 150 appropriation towards this, and I think if we take that step in saying that this is something that you are willing to see legislation towards, and then I can answer questions over the next couple of weeks, I think that would probably give a comfort level to some other entities to step forward.
Very good, thank you.
Any other questions or comments? Letter to be filed.
Letter from City Engineer Thomas regarding I-75 and County Road 99 interchange, PID 102375, planning and design, project number 328-11100.
Any questions or comments? Letter to be filed.
Board of Zoning Appeals minutes for December 10th, 2020.
Questions or comments? Minutes to be filed. Committee reports. We have none. Legislation.
Second reading for Resolution 2, 2021. A resolution requesting the county auditor to make tax advances during the year 2021 pursuant to Ohio Revised Code 321. I think that should be city auditor. .34.
That's correct. County auditor.
Okay, I'm sorry.
Okay.
First reading for Resolution 4, 2021. A resolution approving the expenditures made by the auditor's office on the attached list of vouchers which either exceed the purchase order or were incurred without a purchase order, exceeding the statutory limit of $3,000, all in accordance with the Ohio Revised Code 5705.41D.
Okay, we're showing that as being overpaid. Which one is it?
It's an error on the agenda. It is
Okay,
004.
please note that the agenda showed it as 003. It is 004. Mr. Slough.
I would move for adoption of resolution 004-2021.
Second, Mr. Greeno. Any discussion? Hearing none, all those in favor of resolution 004-2021, say aye if your name is called. Those opposed, nay.
Mr. Greeno.
Aye.
Mr. Haas.
Aye.
Mr. Hellman.
Aye.
Mr. Niemeyer.
Aye.
Mr. Palmer.
Aye.
Mr. Schindeldecker.
Aye.
Mr. Slough.
Aye.
Ms. Warnicki.
Aye.
Mr. Wobser.
Aye.
The resolution 004-2021 is adopted.
First reading for ordinance 2021-4, an ordinance appropriating funds and declaring an emergency.
Okay. Oh, Mr. Wilson.
I'd make a motion that council statutory rules be suspended and this ordinance be given its second and third reading.
Second, Mr. Haas. All those in favor of suspending the rules, say aye if your name is called. Those opposed, nay.
Mr. Haas.
Aye.
Mr. Hellman.
Aye.
Mr. Niemeyer.
Aye.
Mr. Palmer.
Aye.
Mr. Schindeldecker.
Aye.
Mr. Slough.
Aye.
Ms. Warnicki.
Aye.
Mr. Wilbur.
Aye.
And Mr. Greeno.
Aye.
The rules of council have been suspended, and the clerk will give ordinance number 2021-004 its second and third reading.
Ordinance 2021-4, ordinance 2021-4.
Mr. Wobser.
Make a motion to approve.
Second, Mr. Hellman. Any discussion or questions? Hearing none, all those in favor of ordinance 2021-004, say aye if your name is called. Those opposed, nay.
Mr. Niemeyer.
Aye.
Mr. Palmer.
Aye.
Mr. Schindeldecker.
Aye.
Mr. Slough.
Aye.
Ms. Warnicki.
Aye.
Mr. Wobser.
Aye.
Mr. Greeno.
Aye.
Mr. Haas.
Aye.
And Mr. Hellman.
Aye.
The ordinance is adopted.
First reading ordinance 2021-5, an ordinance appropriating and transferring funds and declaring an emergency.
Okay. Any old business? Mr. Station.
Thank you, President Ayrton. I just wanted to make a quick note, because of the style and the way we did the budget meetings this year, we didn't have some opportunity for some dialogue that we might have had in the past, and also due to some things that have been said kind of behind the scenes that have come back to me, and in some of our documentation, there's been some comments or some feelings that perhaps your revenue projections this year are conservative. I wanted to take a moment to tell you they are not. Since I've started in this position, I've made a concerted effort to make sure that in looking at the revenues, we use the information that we have as of this moment in time, and based on this moment in time, to look at it objectively. We analyze, or I personally go through every single revenue item in your budget. So the thick section of green pages in your budget, I reviewed those numbers line by line by line. And generally, my goal is to be within 5% on a projection, particularly for your general fund. 5% puts you within $1.5 million, give or take, of your budget for any given year. And $1.5 million is a swing that the administration should be able to handle, whether it's to the positive or to the negative. So in doing that, and in looking at those numbers line by line, and in looking at the statistical analysis that I use, and in looking at the income tax, the responsibility under Ohio law falls directly on the auditor to make those projections. And I make sure they're not optimistic, they're not pessimistic, they're realistic. So I just wanted to reaffirm that with you as we walk into the 2021 budget year, particularly with us being blessed, having received between Bureau Workers' Compensation and the CARES grant from the federal government, a net of about $4 million to your general fund. It kind of disguises some of the challenges that we really had last year, some of the challenges that you and the administration will have this year, and I want to make sure that we walk into it realistically. So thank you for allowing me that moment to share those thoughts with you.
Mr. Wilson.
I'd like to call an appropriations committee meeting. Brian has asked that we have a appropriations meeting to go over several projects that he would like for us to discuss. Correct, Brian? Is that
Over the entire capital plan, yeah.
the entire capital plan. Also, I'd like to for us to take a look at the $450,000, $420,000 that we're looking at for the County Road 99 project. And those two things. So we've got some things to discuss there. So I think we've got two options we can look at. And as I was talking with Brian, he's not in a huge hurry to have this done. However, if we do put this on February 9th, which would be the Tuesday between the two regular scheduled meetings, he is going to have some legislation in our February 2nd meeting that would get its first reading. Then we would discuss it the following week. So we can either do that, or we can look to have it sometime next week, possibly Wednesday the 27th. So I'm open for suggestions from other members of the committee.
Either would work.
Is in, Beth, are you good? Tom, you good with it either?
27th, I have a problem.
Okay. Beth, are you good either way?
Yes.
With that, let's go ahead and go with the 9th at 5 o'clock in the third floor meeting room on February 9th. And then, so just remember that Brian will have some capital budget items on the February 2nd meeting. Thank you.
Any other old business? New business?
Can I ask a question?
Oh, Mr. Hellman.
Yeah, can I ask a question, I guess, of Jeff or Brian or Paul? Is there a need or a reason to expedite ordinance 2021-005 to move that forward more quickly? No, not so much. Thanks. That's all I needed.
Mayor Muir.
Just wanted to give a couple of quick updates on a number of items. First, COVID, because obviously that's just what we get to talk about a whole lot these days. So far, our numbers have been pretty good this month, where we saw a couple of days where we were seeing about 50 new cases a day, which was a little concerning, but it seems like that's gone down to about 30 cases a day, and the hospital overall is holding up all right. We're not seeing a bunch of patients. So hopefully, thank you everyone who made wise decisions around the holidays. Hopefully we can continue to keep that trend and keep our numbers low. Just wanted to reiterate that we are getting vaccines in our community. We're doing, the health care system and the public health is doing a great job of having a very clear process. If you are in phase 1A or 1B distributions, you can pre-register by calling the phone number that's been released. And if you want it, I can say it. 50 North can assist in registering at 419-423-8496. Or Hancock Public Health can assist at 419-424-7105. You can also complete the registration online at hancockph.publichealth.com. This is allowing us to be able to kind of queue people up. So as soon as we know how many vaccines, because we don't find out until the Thursday before we receive them, then the following week. That way we kind of know how many people are interested, we can get them scheduled. So once you do that registration, then Hancock Public Health or the hospital will call you to schedule that appointment. So that's great, and we're continuing to move through. But I do want to give context. Even though we are starting the process, we have 12,000 individuals in Hancock County that are eligible for within phase 1A and 1B. 4,000 individuals, and we only are getting about 200 to 500 vaccines a week. So it's going to be a slow process for a while as they continue to ramp up. We're getting them pushed out as soon as we get them, but everyone's just going to have to be patient for a while. And as we get more information, as we get more vaccines, we will certainly be notifying everybody. But make sure you pre-register, and we'll probably over the next couple of months start opening registration for all the other phases. So far working well, but it's going to be a slow process. So just wanted to make everyone aware of that. I think that is it for me. Any questions or comments? All right, thank you.
Thank you. Any other new business? If not, I make a quick comment. I keep the family and friends of Toledo Police Officer Brandon Stalker, who was murdered the other day. Our police officers put themselves in harm's way 24/7. We all think that would never happen in Findlay, but for it to happen a couple times in a community near us, it just shows that they do put their lives in peril constantly, and they should be commended. So just keep him in your thoughts and prayers. At this point in time, I will entertain a motion to enter into executive session to discuss some real estate matters. At that time, we ask that all the public leave, the media shut down all media outlets, including our YouTube and our Spectrum. No recording devices will be allowed during that meeting. So I entertain a motion to go into executive session. Mr. Hellman.
So moved.
Second, Mr. Wobser. All those in favor say aye.
Aye.
Aye. Any opposed, nay? We will adjourn to executive session. Mayor Muir.
If I just want to clarify two things, real quick. One, no other business will be conducted following the adjournment of this meeting, just to clarify so the public doesn't feel like they're missing something after that. We won't come back. And then if you could please invite our commissioners who are in attendance to participate in that.
So I need a motion to invite the commissioners. Mr. Wobser. Second, Mr. Haas. All those in favor of inviting the commissioners to our executive session, say aye.
Aye.
Those opposed, nay. They are invited. So we adjourn to executive session. So let's,
We'll wait a couple minutes. to
yeah,
make sure
let's give
everything
about
is
5 minutes for everybody to, and then will you confirm that they've shut everything down?
I will, I'll let the office
Thank you.
know. Will you let me know tomorrow what time?